Okay, so hello everyone. I will repeat the last minute. So I said, hello everyone, welcome again to our virtual open day. I am Dr. Cheney. I'm the program director of the MSc in Eating Disorders and Clinical Nutrition. And I'm here today to tell you a little bit more about our program. And I'm joined by Jamie, and possibly Naima will also be trying to join us. There are two of our alumni from the program. The way we're going to structure today is I'm going to spend some time to tell you a little bit about eating disorders and a little bit about our program. And then I want to spend the majority of the time where Naima, Jamie, and I will be answering any questions that you may have. So just to get us started, I just wanted to make sure we're all on the same page and we understand what an eating disorder is. So an eating disorder is a serious mental health condition, and this mental health condition affects the way we think about food, about our behaviors around the dinner table, but also the emotions that arise from that. Like a lot of those people who work with patients with eating disorders know, eating disorders isn't just about food, and it isn't just about just eating. It's much more complex than that. And the complexity arises from it being a mitigation of a complex interactions of social, genetic, family, childhood trauma, self-esteem, expressing emotion, and social cultural factors all coming together in that one individual who then develops the eating disorders. Eating disorders have core features, but not all eating disorders are the same. The key features are that there are disturbances in eating patterns. So these may be things like food restriction. It could be things like binging, so the exact opposite, and there could be associated with a number of compensatory behaviors. So these could be over-exercising, these could be vomiting, this could be laxative or diet pill misuse, etc. With a number of the eating disorders, but not all, you tend to get distorted body image and the preoccupation with weight and shape, and that's namely with anorexia and bulimia. Though with some of the others, such as avoided and restrictive food intake disorder, ARFID, rumination disorder, or pica, you might not get those symptoms. And all eating disorders, why are we so worried about them? Well, eating disorders, in particular anorexia, have the highest morbidity and mortality, and they are all associated with physical and psychological consequences, which is why it's important that they're recognized early and that they are treated as soon as possible so that the patient will have the best chance of recovering, the best prognosis. So if we think about eating disorder, the two most common types of eating disorders that people have heard of are anorexia and bulimia. However, the most common eating disorder is OSFED, which stands for Other Specified Feeding Disorder, and also binge eating disorder, which is only of late, since about 2017, come into light as a disorder in its own right. Other disorders such as pica, rumination disorder, and ARFID used to be initially considered as feeding disorders, but more recently, since the outcome of the DSM-5 and the ICD-11, both feeding and eating disorders have been combined within the same chapter. So why is it important to think about eating disorder, and why is it important to recognize it? Well, as I already mentioned, they are associated with a high morbidity and mortality. But we also know that recognizing these eating disorders earlier on, as soon as symptoms start to develop, leads to a much better prognosis, much better outcomes. A lot of the time, people are very ashamed. There's already shame associated with mental illness. There's even more shame associated with food and eating disorders. In addition, a lot of the patients who I see, and some of you may see, will know that patients with eating disorders tend to shy away from coming to services, mainly because they don't even recognize that there is a problem. And my last point was around equity and access, and that is something which comes close to my heart because a lot of different cultures present in slightly different nuanced ways for eating disorders. It's important to recognize those and to understand how different ethnicities and cultures present with eating disorders so that there is good equity of care all around. If we think about the global prevalence of eating disorders, we know that this latest study in 2025, so earlier this year, it shows that there is quite a high prevalence of eating disorders, and this is notably higher in females, but we also can see eating disorders in males and also in LGBTQ plus communities. So we know that eating disorders can occur across the world, irrespective of race or ethnicity. It can happen across sexual orientation. Yes, there's a predominance of females, but it can happen in other sexual orientations as well, and genders. But also what we used to see is it used to be considered with countries which are of high social demographic index, and but what we also see that whilst those continue to have the highest prevalence, we've seen the fastest rates of increases in eating disorders in middle social demographic index countries. And what we see is that the projection is that eating disorder trends tend to be continuing to increase, with a prediction of an increase from 357 cases per 100,000 to 373 per 100,000 by 2040. So again, if we look at prevalence, these findings highlight the need that is so important to be able to recognize these eating disorders, and it's important that they also access treatment in a timely fashion. If we look and home in on the UK context, again, we see a similar trend. When you can see in this graph, on your right-hand side, you can see that the trends increase. I would ignore the last column, 22-23, because that's when we had a cyber attack on the NHS system, so not all cases were captured. But you can see up until then, all of the ones increase, and even without the attack, you'd see it would have increased even higher. And what we notice in terms of trends over time is that if you look at 2017 all the way to 2023, you can see a huge jump both in children and young people. So if you look in children, you can see, which I'm talking about 11 to 16-year-olds, you see the trend jumped up from 0.5% to 2.6% in 2023. Whereas in the older adolescents, so 17 to 19-year-olds, again, an even larger jump from 0.8% in 2017 to 12.5% in 2023. And what we also notice is that with this increase, there's also been an increase in hospital admissions. In fact, it's been seen as a 10% year-on-year rise in hospital admissions across time. So with all this in mind and with all this context, and we'll be telling you more about our MSc, let's zone in on what you will be learning on this program. So our MSc is the only degree worldwide on eating disorders and clinical nutrition. It was started back in 2012 by Professor Robinson and Professor Micheli, and it's grown over time, and we're very proud of this MSc. We've also managed to get this MSc registered by the Associate Nutrition Status. So it's also an accredited program, which means that it will give you that robust clinical nutrition background, which is so important when you talk to patients, but also adding that eating disorder current knowledge. In terms of who this program is suitable for, it's suitable for people who would like to continue to work in eating disorders, be that in a clinical perspective or in an academic perspective. In terms of career goals, it's not a clinical degree, so you still need to have your own clinical degree, so medicine, psychologist, dietetics, to be able to practice within an NHS setting, but it gives you that specialist knowledge and that you have that special interest in eating disorders and clinical nutrition, which is so fundamental and will help you stand out from the crowd. In terms of academics, the master's gets you all those foundational knowledge that you need to continue your academic career, which usually means going on to a PhD, a postdoc, and then getting a lecturer position in a university. So in terms of the program, you can take it in 3 different levels, depending on your interest. You can do our PG Cert, or you can continue, which is 60 credits, or continue to our full PG diploma, or you can do the full MSc, which is 180 credits. And we run this program either full-time or part-time. In terms of what the program looks like, it shares 6 modules with clinical and public health nutrition and 3 modules which are eating disorder specific. And we also have an in-depth research project or dissertation project, which is 10,000 words, and it has to be on a specific eating disorder subject. Now, if you spend a moment to look at the table on the right-hand side, those are all the list of modules that you'd have. And you can see it covers all the foundations of clinical nutrition, which is so important when you're working with eating disorder patients, but it also incorporates those eating disorder elements in terms of clinical science and management, so assessment and treatment, and your specialist dissertation projects. So if I spend some time talking about the eating disorder modules, you have in term 1, you have the eating disorder clinical science, and that runs from November to December. And in term 2, February, March, you have the eating disorder management module. And alongside this module, you also get the opportunity to have a 3-day observational placement, which takes place either in term 2 or in term 3. And then across the whole year, you'll be working with a research team and your dissertation supervisor to have that in-depth research study or dissertation project that leads to 60 credits of your program. So let's speak a little bit, how am I doing for time? Let's speak a little bit about the clinical science module. So the objectives for this module are to comprehend the interplay between genetic, environmental, and psychosocial factors in the development of eating disorders. We'll also be thinking about examining those neurobiological mechanisms underlying eating disorders, including the brain regions, neurotransmitters, and neurocircuitry. You'll be helped to understand the role of the cognitive processes and the neurocognitive deficits in eating disorders. You'll be able to recognize the developmental trajectories and age-related patterns of eating disorders. You should be able to understand the comorbidities and the associated mental health conditions in individuals with an eating disorder. And finally, you should be able to evaluate the long-term outcomes of eating disorders, including recovery rates, chronicity, and relapse prevention. And just to give you a bit of a flavor, these are some of the topics that we teach on METC 41. And a METC 42 is more of a clinical-based module in eating disorders. So it goes about management, which means, in effect, all the way from assessment, all through to treatment, across the whole lifespan. So again, if we think about the learning objectives for this, it's thinking about eating disorders symptomatology. It's thinking about how you conduct an assessment. It's thinking about how you describe and differentiate between the different therapeutic modalities. And it helps you to understand the different roles and agencies that work within an eating disorder setting, which will help you understand where you'd like to go in terms of your career. And ultimately, it will help you think about service design and thinking about what are the different therapeutic settings, when would be the most appropriate, and what are the pros and cons from a commissioning standpoint. In addition, as I said, you'll have a 3-day observational placement, and this might be either with children or with adults. Like I mentioned for METC 41, here are some examples of what you will be taught. The other thing that we offer is we have bolsters the didactic teaching sessions with tutorials to have that interactive element. And these tutorials will take place across term 1 and term 2. And they use a combination of problem-based learning and case-based discussions, poster presentations, and also talks from some external speaker about ethics and other aspects which are not covered in the specific teaching days. So what about the dissertation project? What does this look like? What can you do? So again, the overall aim of the dissertation project is to give you that grounding and understanding to do a high quality research in eating disorders. And you'll be getting to work alongside active researchers who are specialists in the field of eating disorders. And your project might look like a systematic review of literature, so like a systematic review, meta-analysis, or a scoping review, a quantitative or qualitative piece of work. It could be lab-based, so we have one at the moment on microbiomes in eating disorders. It could be a service or a clinical audit, or a service evaluation or a service development project, or it could also be translational research. So I'm going to stop there, and I'm going to open up for any questions. So I have a first question, and how is this program open to all undergraduate courses? I study sociology. Is this program an option for me? Yes, absolutely. It is open to all undergraduate courses. You do need to have a 2-1 degree, and you need to meet the English language requirements. I guess what I would say, and I'll bring in Jamie as well on this, is if you come from a sociology background, it would be helpful to do some additional reading around nutrition, and we can support with some reading lists as well, so that you don't find all the nutrition fast-paced and you'll be able to keep up with the lecture. So especially in term 1, there is one of the modules, which is fundamentals, which is very biochemistry based, and that is helpful to have some preparatory work if you just have done sociology, and especially if you haven't done nutrition or biochemistry in the past. But let me bring in Jamie, who has had first-hand experience of this as well.
Okay, let me share a bit. But I did nutrition as my bachelor. So I've had a little bit of the foundation in nutrition, so I find it like a little bit easier for me to do it. But I also heard some of my classmates, they didn't do like nutrition before. Some of them did like psychology, but they turns out they also did really well in the metabolism module. So I think it's fine if you still don't have the nutrition like foundation.
Excellent, thank you. And then we have another question from Cedra, who says, who would you recommend this program for a nutritionist that is also interested in mental health? I would say absolutely. It is very apt for someone who works as a nutritionist and is interested in mental health, because it brings the two together. And eating disorders with all mental health programs, mental health disorders, it's important to have a nutritional background, especially when we're thinking about chronic mental health conditions, schizophrenia, psychosis. Nutrition is really important. But the other key element where you really need the combination of nutrition and mental health is eating disorders. I can't see of any one mental health disorder that has that most closely aligned. Jamie, what are your thoughts?
Yeah, I think it's really helpful as well because for me, I'm doing MSc dietetics right now, and I find it really helpful for me to do the eating disorder and clinical nutrition beforehand because like it gives me a really solid foundation for dietetics because like I have the nutrition foundation as well, and also I could definitely use the eating disorders knowledge and probably use it for my specialist in the future as well. Because like I wanted to be a dietitian in the future, and that's really helpful. And yeah, I think it's like totally related to like nutritionist as well. Yeah.
Fantastic. The next question is from Deborah. So she says, hi there, I've currently applied for this course. However, I haven't finished my mental health nursing course and have been working in eating disorders as a nurse associate for about 2 years now. I submitted an interim transcript. Would that be fine as I don't have a full transcript yet? I think that should be fine. I guess I wonder what, Deborah, maybe we can pick it up outside of here. Emiliana can pop my booking link in the chat so we can have a chat. I guess you do need to have a 2-1 degree as an undergrad, so I don't know if you have that, so that is needed. It sounds like all the rest is absolutely, it's absolutely appropriate. But you do need to have a 2-1 as an undergrad as well.
I think she has sent up.
Said, yes, I get my results in, yes, July 2026. So yeah, that would be before you start. So that would be absolutely fine. Whilst we're waiting for some more question. Oh, there's another question. Do many alumni go on to study clinical psychology doctorates? I don't have the exact percentage, but yes, absolutely. A master's program is really much considered part and parcel of the requirements, almost like an unsaid rule. It seems for clinical psychology, it's become so competitive that a lot of people have a master's degree. I supervise on the Declan Psych. Some of them even scarily have a PhD and a postdoc already. So it's becoming very, very competitive. And also the other thing that would be really good for a clinical psychology doctorate is having that clinical experience of working with different teams. So I think the more you have, the more publications, and this program, all our dissertation supervisors are very keen to support students to go on to publish, and there are lots of opportunities to work with other professionals outside if you want to go that extra mile. So that is definitely encouraged. Jamie, I know you've done some of this work. I don't know if you wanted to share.
Yeah, I did my dissertation last year, and I am like on the process of like trying to publish my paper, but it's like still during like at the process of it. But I'll try to find ways to do it. But if you're just trying to find like ways to do the doctorate, I feel like UCL is really supportive in doing that, because like throughout the term there are like many workshops, like people trying to share like how you can do it, and UCL is really supportive to try ways to help you to like accomplish that. Yeah.
So whilst we're waiting for some more questions to trickle in, I was wondering, Jamie, what the highlights were for you in terms of the program.
I think that would be the observational placement. Because like I feel like that is a really valuable experience in the program, although it's like optional, but it's not easy to have a chance to visit the hospital and try to have an experience, hands-on experience in the hospital. Because like I was in the Royal Free Hospital, the children and young people units at that time, and you can really feel during the consultation, sometimes the atmosphere can get quite intense, but that's something that you couldn't feel it when you're trying to learn like theories and knowledge in the classroom. But as a healthcare professional, you still have to deal with that. So I think that's I really appreciate the psychiatrists at that time, like how they use their communication skills to deal with like the family issues and also the eating disorders of the children at that time. So I definitely learned a lot from the placement.
Excellent. Thank you for sharing that. And in the meantime, Asia has come back and has said, project area, service and clinical trial. How much clinical trial is involved within the project? I'm not sure what you're referring to. Let me just check my slides. Oh, service or clinical audit. So it depends on what the type of, that's the type of project, Asia. So you can have a service audit, which is looking at how the service operates in comparison to a gold standard. So looking at the national standard and guidelines for setting up service, or you can have a clinical audit. So it's looking at how is the clinical practice and how close is it to a gold standard. So I think that's the one you were referring to. But you can have research, clinical research projects, and the best way to go about that, because a master's is 1 year, so it's not actually a lot of time, is to join a group and a research group who is already active, has already started working on the project, and you support and do a part of it. So, for example, at the moment, I have a research study going on intensive outpatient programs, and I've got 2 master students doing some qualitative research with patients to see what their experience is, how we can improve services, what are services like, and what is working in intensive outpatients, why are they effective. So they're doing 20 patients each. Obviously, the bigger project has much more patients, and then we'll all publish it together. So that's a bit of an example, Asia. I hope that answers your question. So there's another question saying, given my background in neuroscience and psychology and my specific interest in academic research of eating disorders, particularly underlying neural and cognitive mechanisms like decision-making distortions, is this eating disorder and nutrition program a suitable pathway for pursuing this type of research? Or should I be looking at more general neuroscience or psychology MSc programs? I think that's a good question. We're not a neuroscience. We are not a neuroscience masters. So if you're looking at neuroscience masters specifically, then that might be more up your street. But then the neuroscience masters that I know of aren't specific to eating disorder. So I guess it's which way do you want to, which line, what is your interest? Are you interested in neuroscience and eating disorder is part of that interest? Or are you interested in eating disorders and then you're interested in the neurobiology and the neuroscience of it? If it's the second one, then our program would definitely fit that. Our clinical skills goes into the neuroscience aspect. You could also look at getting a research project, which is looking at those decision-making processes and neurocognitions and neuroimaging. But if your interest lies more in neuroscience rather than the eating disorders, then we're not a neuroscience masters. Did you want to add anything, Jamie, to that?
Yeah, I think you have to like make it really clear to try to see what's your interest because like you also don't want to get into a program that you're not really interested in, find out like you're not into it. Yeah.
And then the next question is, in your opinion, would someone be able to continue to work part-time doing shifts as a support worker, nights, etc., whilst doing a part-time MSc? I'd say absolutely. If you're doing it as a part-time, there's definitely that's the whole point. Why we offer it as full-time and part-time, because we recognize, especially in the current economic climate, some people might need to work. And in which case, doing it part-time and continuing your shifts would be absolutely fine. And actually, it will probably enhance it because you'll get that clinical experience and you can see things working with patients, which would actually help. But yes, I think if you're doing it part-time, that's fine. I think full-time, you need to be a bit more careful because it is quite a fast-paced course and program. Right. The next one is, oh, maybe I'll hand this one to you, Jamie. What advice would you give someone that would start this course? That's a very nice one for you. What advice? You've done it, been there, done that. What advice would you give someone who's starting off?
I think first of all, like do not give yourself too much pressure on like giving yourself a mindset that you have to know everything. Because like you wouldn't know everything at the very beginning, but because this is a place for you to learn. So just like you come here and learn is fine. And the second thing is like really have to manage your time really well. As Dr. Cheney said, it's a really like intense course, to be honest. So you have to really try to plan your schedule ahead and to organize your stuff really well. And so to like make everything really organized. Otherwise, when like deadline comes ahead, you'll be like really like you have like things cramped up. So you have to try to make things really organized and manage your time well, I would say. And I would say if you're really find something really confused or you're not sure about, just reach out to the professors because like they're really nice and supportive. Because for me, if I'm just like unsure about anything, I'll just go and ask or drop them an email and they'll just like answer me when they're like available. Yeah.
Excellent. Um, the other questions, what career opportunities do we have after completing this degree? So as I was saying, there are usually two paths which you can continue after an MSc. One is the clinical route, where you can continue to get either into the declin psych, counseling psychology, dietetic program, so that you can then work clinically. And then you can say, I am a clinician and I have a special interest in eating disorders, and this is the MSc that shows it. The other route is a academic route where you continue. The MSc is the bridgeway between undergrad and the PhD. It's getting you that foundational skills that you know all the academic different settings to put you in good stead for a PhD and a postdoc, lecturer, senior lecturer, and professorship. So working at a university. We've also had some students who have gone on to develop their own private practice. We've had students who have gone on to become ward managers and service managers. We've had students who have gone on to be commissioners, who have gone on to work in charities, have become bloggers, have written books as well. So we have a huge range of career prospects that people have chosen. Jamie, what about your trajectory? What have you done since graduating?
So as I said, I'm doing the MSc dietetics at UCL after I've done the eating disorders and clinical nutrition. So like probably I'll just be a dietitian in the NHS after I've graduated from UCL. And like maybe years later, I'll maybe specialized in eating disorder because like I have the foundation for it. Yeah, because like it really helps me to develop like skills and knowledge in that. Yeah.
Fantastic. So we have someone who's asked, I've got a 2 degree. Would I still get accepted to the course if I've got lots of experience in eating disorders? All I can say is apply and emphasize and show the experience in your personal statement, in your CV, etc. The eligibility criteria are what they are, and it doesn't mean that you can't apply because each application is taken in its own merit. But if you do get accepted, that would need to go through a separate process with the central team just for parity. It would need a suspension of regulations, etc. So, it's a bit more complex. So I would say if you have a 2-1, you're definitely in. If not, don't still apply and emphasize the experience that you have. Another one for you, Jamie. Any advice on the application process?
I would say for your personal statement, try to like show what soft skills you have from your experience. That is like a really important thing that I think professors want to see from your personal statement. Like, and like try to show what you've learned from like any of your volunteering or research or like internship, because like you could learn a lot from those experience. For me, I did some kind of like nutrition intern and different kinds of like research before, and they helped me develop like communication skills as I work with subjects in the research. And for example, when I work with clients in the nutrition consultancy, they can also help me develop like communication skills and problem solving skills, and also like nutritional assessment, those kind of things. You can like show people what you've learned and show people you've got that skills. Yeah.
Perfect. What I would add to that is in the application process, make sure that you fill in the complete application. So make sure that you have all your references up to date. Make sure that your references are coming from their work email, so that they can easily be verified. Make sure that you've completed all your employment history, any volunteering experience that you have, like Jamie mentioned. Curricular, we look at degrees, so curriculum and 2-1 degrees, etc. But we also look at what else, what's the individual who's applying. So any other aspects, if you've done any charity work, any additional extracurricular activities that you've done, make sure that you list them, and make sure that you list them in the right places in the application so people will be able to identify these, and make the personal statement. We don't want to see a ChatGPT, Gen AI generated personal statement. We want to know who you are. So make sure that it's very personal, and tell us what's your passion, why you're interested in applying to the program, why you're interested in applying to UCL, where you'd like to go, what are your dreams. Give a flavor of who you are. So, Jamie, whilst we wait for a couple of more questions, I was just wondering about what your experience was on the program and whether you were happy to share that.
I
You've
think
told us
over
about the highlights, which is great.
yeah. Yeah, overall it was like very good, but also it was a very challenging program, to be honest, because like it is really intense, as you've mentioned, especially for the first term. There's like the module about like metabolism. If there's like students haven't done nutrition before, it can be like quite demanding. But if you can do like extra reading on that, and you read some like extra materials that the professor gave you, I think as long as you did like all of the like stuff like that, you can you can ace that. Yeah. So it's not really like hard to manage like all of the stuff, as long as you really try to manage your the deadlines, and not leaving all the things until the deadline, and do it like step by step, and just try to reach out to anyone if you're not sure about anything, because like people here are just really supportive. And what I think it is very good here is like professors here are really guiding you to like think critically, not just here to spoon feed you, I feel like. Because like before, when I was learning in Hong Kong, the learning culture is like a little bit different, I feel like. And here is like they really guide you how to think. And so I feel like I really understand like the process of how A develops into B, but not just like memorizing all of the knowledge. Yeah.
Thank you so much. It's really insightful and helpful. Right. I'm not sure we have any other questions. So Jamie, I don't know, thank you so much for coming to support and help. I don't know if there's anything else and any last tips that you want to leave our participants with.
I would say like although I'd say it is like a really demanding course, but turns out it can be really rewarding. Especially I meet a lot of classmates from all over the world, and I meet a lot of friends here. Like despite like the academic side, I also like meet a lot of friends here. So it's not just about like studying here. Life in London and life at UCL is also really good. So I would say this is a really good program if you would like to try to have a study experience in London and try to um, enjoy a life here, or if you're not from England, you would try to study abroad. And this is a really good place because like this place is really international and people here are just really supportive, and overall it's just really rewarding and helps me to develop a really good foundation for me to get into the masters I'm in right now. Yeah.
Thank you so much. It's really helpful. And we have a last question, which is, well, we can have more, we're still in time. Please, can you recommend a casual reading book to start thinking about this? Well, I think one of the things I will recommend, if I can show it to you, I'll just bring it from here. I'll show you two things. Can you see that book? No. So I will read out the text. So there is a textbook that a lot of our lecturers on the course have contributed to, and that is Eating Disorders: An International Comprehensive View by Springer. And that's a really good, very comprehensive textbook that we would definitely recommend. If you want something just to start off a little bit lighter, a little bit less dense than a 2-volume textbook, then I would recommend going to this one, or you can't see it with my background, which is called Cutting Edge Psychiatry in Practice. And there's the 6th edition, so it's in cepip.org. And the focus issue on eating disorders. And I was the guest editor for that. And it's a really good collation of cutting edge experts who have written different chapters, all the way from assessment, all throughout, the use of neurosurgery in anorexia. So very varied. So I can pop those into the chat. Oh yeah, or yeah, I can send them to Emiliana. I can just see she's just mentioned, and I can send you the links to both and you can have a look. The journal one is open access. I will try and find them whilst we wait for maybe a next question. And maybe whilst I do that, Jamie can keep an eye on the chat. So that's the one. Emiliana, where am I popping it? In the chat? There we go. Great. So that is the Cutting Edge Psychiatry in Practice, Emiliana, and I will find the Eating Disorders and International Comprehensive View. And this is the Springer one. Emiliana, I've put them both in the chat for you, so you can share them with the participants. Okay. If there are no other questions, I will look forward to seeing some of your applications. It'd be lovely to see you on the program. And there is a booking link, which if you have any other questions, sometimes you know how it happens. You come off a call and you go, oh, I wanted to ask that one question. And there's a booking link where you can just book in to meet with me, and I'll be very, very happy to chat to you. And again, Emiliana can pop that in the chat for you, so you can just book that in, and I can see that some of you have already used the link, so that's great. And I look forward to speaking to you. Excellent. Well, thank you very much, all of you, for participating. Thank you, Emiliana, for hosting and organizing all of this. And a very big thank you to Jamie for joining me in delivering this and answering all your questions.
Thank you.